attend to this meeting today. I'm very honored to be here. I think that before I even deliver my initial words, I want to recognize the importance of events such as this that are designed to stimulate sharing experiences, the debate of ideas based in science to trigger decision making. And in many times these are conflicting ideas, but I think that the dialogue is what generate new ideas, new solutions that push us forward together, especially if we share this sense of solidarity that builds positive collaborations among nations and communities and between the private and public sectors, the civil society. And I guess that sometimes we tend to forget that these spaces are earned, they are conquered, they are not given. And so thank you very much. I want to congratulate you all for doing this, for forecasting healthy futures. I know that a lot of my friends are there. I'm receiving already some pictures of the event, very successful event. So thank you very much once again for doing this and for the opportunity for me to collaborate in that. For the ones that know me, I tend to be an optimist. Maybe I'm not such an optimist as I was before, because in the past I used to say I am an optimist. Now I tend to be an optimist, but I believe it's an incredible moment of leadership of countries of the Americas and from the global South. And I prefer to see that things are moving forward, especially when some steps. So last year, Brazil had the presidency of the G20, and we saw progress in some areas, especially with this global alliance to tackle extreme poverty and ending hunger, but also on climate change and health, on water sanitation, hygiene, and other topics. And just a few months ago, Colombia hosted COP16 biodiversity. I will dedicate some moments in my presentation to talk about the road of health and biodiversity in a moment. And I know that a lot of people who are in this forum also supported this process. And this year, in fact, a couple of weeks ago, we just came back from Cartagena, Colombia, for the second global conference on air pollution and health, where we had over 60 countries committing to reduce in 50% the health effects related with air pollution, which would trigger these global and collective action to improve air quality, to monitor health indicators, to improve health surveillance systems, and to push forward this important agenda that kills over 7 million people worldwide and 370,000 people in the region of the Americas each year. So in this year, we have Brazil as the presidency of the BRICS and also hosting COP30, which it's always amazing to think back that after the Rio conventions has flown all over the world, and now somehow they are finding their way to be connected again, to be discussed again in a similar way that they were somewhat envisioned in the Earth Summit of Rio 92. So it's incredible to see the efforts from Brazil and from other countries of the region of the Americas and all over the world to make this connection back on track. So a little bit, and since I know that some colleagues will follow me discussing the connections between biodiversity and health and climate change and health, a little bit of the history behind these connections that I was also fortunate to be part of initially as part of Fiocruz, and Dr. Paulo Gadelha just preceded me, and he was a president of Fiocruz in one of these moments. And so during the 2010 Nagoya Protocol, the Aichi targets, those were very important moments where we were able to build a global consensus, although the implementation of all those processes were probably not ideal or not what was expected, but they were progress nonetheless. And especially the 2012 Biodiversity and Health Plan in Pyeongchang. Then we had the same recognition in WHA a few years later. And then maybe fast forwarding a little bit to the approval of the Kunming-Montreal Global Biodiversity Framework. And just a few months ago, the Global Action Plan on Biodiversity and Health at COP16 in Cali, Colombia. And what followed in Rome, what was called COP 16.2, that was an amazing effort also to mobilize additional resources, not only financial, but also the people's resources to advance with implementation of a climate change, of a biodiversity and health agenda. And a little bit of the road of climate change and health. We had in the Americas, actually one of the first specific actions dedicated to climate change and health as the Pan American Health Organization, the Caribbean Action Plan on Health and Climate Change, where we had 23 ministers of health and environment aligning and putting forward an important document and commitment to advance with the Caribbean, one of the most affected regions in the world by climate change, and having incredibly extensive health effects. Also, we had the same with the Andean Action Plan, the Mercosur Agreement. And then fast forwarding a little bit, we had in Dubai the UAE Declaration, the first Health Day, and then following last year's WHO's Global Resolution on Climate and Health. And now we are currently preparing with countries the plan of action on that. And PAHO's policy on equity-oriented action on climate and health. So in that policy, we had 5 lines of action. One of them focused on adaptation on climate and health. The second one on mitigation on climate and health. The third one, strengthening the importance of an equity-oriented action where we can have health equity indicators as well to monitor progress, increasing social participation, and with action happening at the local level. We know that mayors and local level and communities, they play a very important role, especially when finding proper solutions and implementation. And I think that that's where we are putting a lot of our dedication now in the region of the Americas as the Pan American Health Organization, and working with compact of mayors and directly with cities. And I'm going to mention a few examples soon. The fourth line of action of this action plan refers to improving data and the connection between health surveillance information, health equity information, and the social demographic and meteorological services. And the fifth line of action is increasing health and climate financing from multiple sources, including philanthropics, governments, and Green Climate Fund and other mechanisms that exist. Later this year, we're going to have I'm inviting you all through this mean to also participate and support the Pan American Health Organization and Caribbean countries in expanding a new Caribbean Action Plan on Health and Climate Change. The first one we received a good funding from European Union and the Green Climate Fund, and we are hoping as well to be able to advance with this agenda in the near future. with the support from all of you. We provided trainings. Anna Stewart from IAI is there, and we provided training for health professionals in the Caribbean and elsewhere in the Americas. And we worked as well with GCHA. I know that Jess is going to follow me soon. So I mean, many of our partners are there. And just recently, we had the first informal consultation. Unfortunately, I couldn't hear Agnes Soares this morning, but I guess that she spoke about these informal consultation that we had in Brasilia, in PAHO's venue in Brasilia, where we started discussing these or continue the discussions on a climate and health program to be presented and spearheaded by the Brazil's presidency for COP30. And now it's me talking, not Brazil, but I'm hoping that we can move as much as we can to have something close to a resolution that is going to trigger action by the Green Climate Fund on a specific line of interventions and investments on climate and health. So knowing that the next session is going to address some topics, I want to raise 3 or 4 ideas for these next panel. One of them is on how to build governance, and Dr. Paulo Gadelha just referred to that, the how to link SDGs, climate change agendas, and these whole implementations. And one of the things that I want to call the attention is that we one of the topics that we could all coalesce to could be health, because health is the endpoint of most of the actions that happen elsewhere in other sectors are going to be reflected in health and environmental health. So either through direct effects on human health or through damaging ecosystem services that in turn is going to also reflect on loss of health indicators. So we really need to build, and the question is how to build this governance of intersectoral action to have some dedicated focus, at least as an endpoint, on health as one of the main indicators that could be collected through these joint efforts between sectors, between private and public, between communities and nations, so at all levels. And we must focus on prevention first. I know that the health sector tends to be very curative and responsive and treatment oriented, but I think that in this case, we need to focus a lot more on prevention topics. And we've done a lot of vulnerability and adaptation assessments for health with over 17 countries as of now in the region of the Americas, where every time that we've done that and supported countries in doing that and having health as the endpoint of climate action in this case, we saw that the ownership of the processes of transportation talking, I'm going to save lives, of agriculture saying I'm going to save lives, or infrastructure, and all of them knowing how much they are contributing to health effects, it's a very powerful argument. And I think that using that argument and knowing that all sectors should also have this argument in their hands, spearheaded by the health sector that can teach them, that can measure and support these other sectors in improving and delivering health, is a much more powerful way of doing that. So far, as at least from the NDCs that I could scan in the last few minutes, in the last few days, we had 26 NDCs 3.0 already submitted last time that I checked, 12 from the region of the Americas, meaning almost half were countries from the region, and all of them recognized health as a important topic. We've been also supporting countries in preparing the NDCs, and I think that's in the next session, they're going to listen as well about the NBSAP's National Biodiversity Strategies and Action Plans. And I think that health is a very important topic to be linked to these activities as well. So when the attentions are being dispersed and funds are scarcer and scarcer, seems logic to do what Paulo Gadelha was mentioning, to integrate them and to unite them under the same governance structure. But how can we do that? So one of the suggestions is by using health indicators to plan activities to measure the success, not just to measure the success, but also to plan the activities in advance, to estimate what the health co-benefits, including the health economic co-benefits could be of interventions, and also never forgetting the importance of increasing health equity. So making sure that whatever services, whatever products are reaching everyone, especially the ones that need it the most. So, and we are working much more on city levels now. So we are working with mayors, with secretaries in local level, and asking the Secretary of Transportation, of Energy, of Agriculture, how many lives you want to save. And we can do these assessments in a very concrete way. And many cities in the region are now using this set of tools on, for example, being guided by health indicators, changing transportation modes or improving active transportations in parts of the city, or improving green spaces in city, thus reducing heat island effects, promoting physical activities, reducing diabetes type 2, for example, improving air quality, improving mental health. And we can measure those benefits very concretely through a strong health surveillance system and monitoring with other sectors. Also on reviewing building codes, using and measuring nature-based solutions for health. We had that document coming out last COP. I invite you all to visit it. And for example, with Colombia, we estimated that if Colombia implements everything that they're proposing in their NDC, we could have a almost 1% saving in their GDP per year, just considering the improvements in air quality to human health. And that's why Colombia also hosted this important event in Cartagena a few weeks ago. And it's very important that we learn to incorporate the health dimension and the health economic benefits in everything that we do, because all sectors have a role play into promoting and preventing disease and promoting health and health equity in their actions. And finally, in Latin America and the Caribbean, the importance of traditional medicine translates in a big way to traditional knowledge associated with medicinal plants and other benefits from nature. I'm bringing this because the next session is also going to talk about the linkages between the three Rio conventions. And I think that COP16 reinvigorated the discussions around Article HA. For those that might not be well versed in that, it's the one that mandates the recognition of traditional knowledge and fair and equitable sharing of benefits arising from the use of genetic resources that has been discussed since 2010. And it's very important that we can recover that, because it talks a lot about the social technologies that Gadelha was referring to, but also on recognizing the importance of traditional knowledge in the processes of using and extracting the benefits of nature to human health. And similar discussions are going to be very much present at COP30, especially in the confluence of health and climate change. Since in developing countries, health services are not yet universally available, health services will need to be improved in the regions where they exist and expanded in order to reach out to all people, including and most importantly the ones in situation of vulnerability. And again, I think that nature-based solutions for health will play a pivotal role in helping building this low carbon as much as possible, but low carbon and climate resilient health systems for all. And I believe that these issues of just transitions and common but differentiated responsibilities will be very much present in the discussions in this COP, and as they should, and the connections of and the importance of health in the GGA, the Global Goal on Adaptation, and especially in the loss and damages fund, where health losses account for massively significant amount of these losses. But we really need to do a better job at strengthening health surveillance systems, including the improvements in early warning systems, but remembering that countries are now flooded with warnings and with very little capacity to respond. So that's also something that I hope that the panel that will follow can also address, how to find a good balance between these two in order to respond to these important challenges. So I'm like I said, you are in my hometown, so enjoy Rio. Go to Lapa, have some caipirinhas, listen to some chorinho. Tonight, go to Maracanã, watch my team Flamengo playing, and to end with the words of Tom Jobim on the song Waters of March, because probably going to experience some Waters of March, and then later you let me know what you think. It's a promise of life. It's a joy in our heart. I hope that you can also enjoy your time in Rio. Take good care of my beloved hometown, and I'm sure that the city will return to you in the same manner. So thank you very much once again for the opportunity, and I hope you have a very successful event.